One.
I'm Rachel Yates, freelance consultant. I'd like to thank the panellists for the great presentations. And I think a number have referred to the other structural drivers of mental health and psychosocial distress, including the economic factors, which brings me to Nicola's point about the importance of looking at child protection and social protection opportunities. And for some time, I think we've failed to really look at cash and care collectively. And I'm just wondering, possibly a question for Maureen, where UNICEF is scaling up cash transfers in Jordan, where you see the opportunities to bring together some of the child protection and social protection opportunities to provide more comprehensive support.
Thank you very much. Who's next? Surely there must be somebody who wants to ask a question. Please, thank you. Don't be afraid. The gentleman here. I know you're all experts, but it's great
Morning,
to hear
everybody.
how much
Thanks very much to the panellists. My name is Dan Collis and I work for War Child. And I have a question that picks up on what Nicola was saying about evidence, but it's particularly for Mohsen. You were talking about how you're making special efforts to measure change in some of the indicators around emotional intelligence, empathy, confidence, that sort of thing. And many agencies are trying to do that, but it's a difficult thing to achieve, and it'd be interesting to know a bit more about the kind of indicators that you're looking at and how you're gathering the evidence that shows change against them.
Somebody from over here, this corner of the room. Thank you.
Hello, my name's Jenny Humphreys. I'm a freelance consultant, and I'm still trying to formulate my question.
Don't worry, just say it as you feel.
I'm thinking of that building back better suggestion, and wondering if there's something to be said about the challenge of countering community rejection, of trying to sort of move away from those embedded sort of dangerous practices like sort of child marriage, etc., and the consideration of these communities that these are perhaps, or the changes that we're suggesting are Western concepts or Northern Hemisphere concepts.
Yes.
And in a conflict situation, that perhaps being even more difficult when some of those Northern Hemisphere or Western countries that are sending over their NGOs are also party to the conflict in some way or other. So be interested to know from our panellists if they've sort of encountered ways in which those narratives from the community can be changed.
That's why we have to have local people, men and women, but women in particular, at the peace table, because that's absolutely vital. And also this bundle of questions. Thank you.
Thank you very much. James Denslow from Save the Children. I just wondered, going back to that statistic that Mark put out, about 40% of children in conflict-affected areas suffering some degree of stress. Obviously, the focus naturally leans towards understanding that 40%, but I wondered how much research and evidence there is around the 60% who aren't suffering, and what we can learn from that when it comes to sort of this rather complex, holistic, multisectoral issue that you've all outlined.
Just before we come to Mark, Emanuela, any answers?
Yeah.
You feel you'd like to answer any of the questions just now?
Sorry?
Would you like to answer any of the questions?
Okay, I wasn't really getting them well. I don't know if some of the questions
when we
could be
come
read
back
out.
when we come to the next few, we'll ask you then, so you can hear hopefully better. All right, Mark.
Sure, I can start with the last question, and thank you for raising that. I always struggle with bringing out that figure because it focuses on indeed the weakness and the problems. So I'm happy you picked it up. I think traditionally research has been better at identifying what the problems are than what strengths are, and especially the construct of resilience is something that I think has been very much brought forward but ill-researched. So I think that's one of the reasons why it's been there. But I think there's a lot of very strong evidence on protective factors, especially in situation of adversity. And probably the most powerful being the family, and it's been raised a couple of times on the panel and also in our work is having a healthy family setting, having parents that feel empowered to take their parental role, is probably the most important protective factor that I think predicts children doing very well in situations. And I think it also calls for focusing on that. I think traditionally a lot of the interventions focus on children, and that makes a lot of sense. That's what we're there for. But if you're looking at reviewing again the literature of what's out there, there's very few interventions that are out there that are tested that focus on the family or the parents. And I'm happy to hear it was part of some of the presentations today. War Child is definitely focusing on how can we target families and caregivers to increase their well-being and their parental capacity. So I think it's definitely a lot to be gained there.
Thank you. Maureen?
Thank you so much. Very good question indeed. And you've actually predicted what we have currently done. In 2017, we moved Makani platform to link up with our cash program, cash assistance program. And that is called Hajati. Hajati is an Arabic word again, means my needs. And what we have done is that we are understanding as much as possible that for you to, in a cash social protection program, you need to address both the economic and social vulnerabilities. You cannot either or. It has to be a comprehensive approach. And as I already described, Makani already is providing comprehensive approach linking to education, to child protection, addressing the psychosocial well-being, working with the whole ecosystem. That means the community, the government institutions and systems, as well as the families, looking at a community-based child protection approach in how we're addressing that. And then looking at also how we link youth as an economic platform, giving them the right 21st century skills. We've introduced a new component called Innovation Labs, where we are working with adolescents and youth to give them 21st century skills in design thinking methodologies on how they can actually be contributors and contribute to their own life and transition into adulthood and hopefully employment. So we are working on that. In terms of the questions that have been asked on how can we make cost-effective changes in the programming, considering that the funding situation is really shrinking and we need to look at more sustainable models of how we are designing our program. I will talk briefly of another bold move that we made as UNICEF Jordan. In Makani approach in camps particularly, we have moved to a community-based approach. Initially, we started the Makani, which were run by international organizations. Then now we have exited the international organization. We have built capacities within the Syrian communities. And now we are handing over the Makanis to be run by the Syrian communities themselves. This is not only helping us in gaining efficiency gains and effectiveness in how we deliver this program, but also having this program redesigned, driven by the Syrian communities, and made appropriate to respond to their own needs. And this is one of the models that we are trying to ensure as much as possible, even within the host community, our approach of mainstreaming and ensuring sustainability of some of the services given the funding situation in the host community has been how we nationalize and leverage on governance systems, including local NGOs and CBOs and institutions like the Islamic centers who also get a lot of funding support from non-traditional donors, as well as they have that leverage to mobilize a huge capacities of the communities because they are respected by the communities. These are some of the new innovative ways that we are moving as UNICEF. So in terms of how do we ensure evidence, it will be very interesting in how we build up some indicators to track of the community-based approach models that we have put in place, both in the camps and in working with the Islamic facilities, the Islamic partners. How do we track and ensure the effectiveness and sustainability of these models over a long time? The other thing that we are looking at some of the indicators is when we started our Makani program, our psychosocial program at the onset of the conflict focused heavily on the mental health and building on that psychosocial effects of the conflict. But then as the crisis became a protracted crisis, where we are talking of 5 years after the conflict, the issues that the refugees are facing is now integrating them into the community. The discrimination, issues of building on their social cohesion. How do you establish platforms where Jordanian families and Syrian families can come together and work to contribute as one community? The other thing is that how do you build a civic identity for an adolescent to be able to feel that I'm part and parcel of this community? And how can you create opportunities where they can be positively engaged economically and socially and also politically? And that way you will reduce the effects of the illegal migration, effects of harmful coping mechanisms like getting into extremism, violence extremism, or getting into child labor or other aspects that you can imagine. Yeah, thank you very much.
Yeah. So I think it was Dan. Yeah. So I think I'll start with your question. So, from our side, there's several angles to this. One, because we're activating youth-led, refugee-led hubs where young people are literally and figuratively authoring their futures, the content that they're coming out with is evidence. And one of the things that we're trying to fund for is to build a tool that will enable us to tag and pull out key concepts and ideas and challenges that are coming out, because we're getting hundreds of stories where the refugee teams that are replicating our work, I'm not replicating our program, by the way, it's the Syrian changemakers in Lebanon, Turkey, and Jordan that are replicating our program. They've replicated it in the last 10 months to more than 700 youth in 8 cities across those 3 countries. So we have hundreds and hundreds of stories, and a lot of them are touching on psychological challenges or discoveries or needs, and we don't have the capacity to run through all of that in a timely way. And also, there's data there that we're missing. So we're trying to come up with a technology to tag these things and have a data visualization where we can pull these things out. That's one. In the last 10 months, we have piloted a psychometric scale, and this was diffused through our refugee teams, and it was done for more than 300 youth. We were measuring for it was a pre and post assessment. It was on a scale, I think it was 1 to 5 or 1 to 7. And it was 30 questions, and each refugee team was dispersing the scale to the hubs that they were mobilizing. We found a lot of interesting data from that because we were measuring for empathy capacities, perceived stress and situational control, collaborative leadership, and creative problem solving. What we found was there was too many gaps in that data to have something that was rigorous to be able to publish. There were several reasons for that. One, we realized that the M&E that we were coming up with, and this is for all of us in the field, was come up with us in an office and not in the field. I was approaching my M&E strategy not with the intent of building it and defining it with our brothers and sisters who are living as refugees. I was defining it and coming up with it for funders and to satisfy governments, which is ridiculous. So I had this epiphany in the last year. But within that 10-month scale, we did have something valuable. We found consistent patterns of reported enhanced capacities for perceived stress and situational control, which was an indication that a lot of our narrative, we take from narrative therapy and logotherapy, which is used a lot, but there's not enough evidence supporting that it's clinically actually showing things, improvements. But what we're trying to do is we're trying to change that. But perceived stress and situational control was across the board in those 3 countries was something that was changing. A large percentage of respondents were saying they had a greater sense of, emotion regulation and things like that. Empathy capacities were increasing, but not consistent enough. In some cases, it was reported less, which was interesting. And creative collaboration, actually that increased. But again, there was too many gaps across countries. So what we did I was in the field 2 weeks ago. I was in Lebanon and Jordan with our refugee teams. We did capacity building with them. And one of the main capacity building things we did was on M&E. And we completely rebuilt our scale. Because here's the other thing. We're coming up with these things in English. So a lot of these concepts, they mean something different in another language. So you have to change everything with them. So exactly. Yeah.
So language is so important.
So we actually workshopped with them how to change the scale and what they thought we should be measuring for. And we had a neuroscientist with us to talk them through some of these concepts. So we changed it. I'm going to read some of what we're now focusing on. Executive function, because with executive function, you can tackle working memory, mental flexibility, and self-control. Emotion regulation is there. Cognitive empathy is there, and then perceived stress. And we're taking from a number of scales and inventories. One of them that I'll mention is really interesting. It's the alexithymia, alexithymia scale. So we're seeing an inability of a lot of youth that have been through trauma to actually understand what they're feeling and then actually communicating it with words. They don't know how to do that. In some cases, this scale is being used to study the effects of or the indication of autism, right? I'm not saying that's what we're doing, but the inability to even know what types of words to use and how to say it, what you're feeling, that's a huge barrier and a detriment for us to build community, to have peace builders, for even parents to know how to care for their children. In a women's shelter where we now have mothers replicating our program for themselves, one of the main stories coming out of their narratives is, I don't know what to do with my kid, because when they hear a door close, they're hypervigilant. They're in that state of hypervigilance, or they're completely numb, which is they're in that depth of trauma. So enhancing the ability of a young person to actually communicate and put together, connect their mind with their heart and their breath, and to communicate what they're feeling, I think is a really important thing to measure for. And you can do that through some scientifically verified scales. So in the next 5 months, we're going to pilot this new scale that we built with our brothers and sisters that's defined by them. We're going to have this scale reach to 300 refugee youth, because our refugee teams are replicating the program for another 5 months to 300 youth. That's our target for the next 5 months. So hopefully we'll have cleaner data. But the initial data indicated that the most consistent pattern was narrative therapy was contributing to their ability to control their emotions, to have some pause instead of react impulsively. The other, if I may, just really quick, she brought up a really great question. Maureen, was it? On community resistance?
Yes.
I thought it was really important.
It is. It's wonderful.
One of the things about community resistance is that we have to accept that we don't know everything, and we have to accept that not everything's going to happen in our time. A lot of the programs that come in as CVE, a young person going into a program that has the mention of CV in it is not going to, that doesn't make any sense. Even countering gender-based violence, a program that has that in the title, it's not going to happen organically. And one of the things we realized was, if you create a safe space where people are actually building their communications assets to effectively communicate what their needs are, those things will come up organically. And we saw that in Zaatari refugee camp. There was a group of girls who came out with all of these narratives that were male-driven stories, male-driven narratives. So then we had a discussion about, why are these male-driven narratives? And then an organic debate happened, organically, from them, where they started to question, and the question was coming from them, it wasn't coming from me. And then 2 weeks later, not all of them, but more than half of them changed their narratives to female-driven, which is an indication of some type of mindset shift. So I think the important part is the space that we build. What type of space are we building for these things to come up organically? I think that's the key issue.
Thank you very much. I've got some questions from online, so I'll just ask them, and then I'll take those. This is a question from David Jones from the International Federation of Social Workers and Commonwealth Organisation for Social Work. In how many countries social workers on the front line of children's protection, there is a growing literature on social work and child protection? Is there a need for more joined-up approach to child protection in social development and social work? A question from Anita from the Global Trauma Project. How to promote sustainability, in particular, how to ensure long-term capacity building through training, mentoring, and access to resources. And then we've got a question from Claire from the Procton Centre. It would be interesting to hear how many of the panelists' organisations consider and practically address the balance between innovative child protection and interventions and the localisation of the aid agenda, please. So I think those three questions are sort of based at all of you. So who would like to take the first question? Emmanuel, do you want to answer any of these?
Okay, I'm talking about... Okay, so the last question was talking about sustainability of some of the programs.
Yes.
Okay. Yeah, what we've been doing so far in Nigeria, most especially in Search for Common Ground, is to train our beneficiaries, direct beneficiaries, to go back there, step down this training. Like, we've trained children on conflict transformation, we've trained them on trauma, resilience, and awareness. It was so surprising to know, not really surprising because they're kids, to know that most of them doesn't even know about trauma. But after they undergone this training, they knew what trauma was, and they're going down there to step down this training. We've even taught them techniques on how to be able to help others in traumatic situation. And then talking about transformative peace building dialogues and rest, and we've really taken our time to invest on our beneficiaries so that even if we're not there, they already have these skills. And we always encourage after each training, they should go down to their communities and step down this training. So they said information is power. So once they know about this, some of the techniques and they know the issue, they'll be able to step down or help their communities even when we're not there. So it's part of our sustainability plans to keep up the work we're doing in the communities. I don't know if she's...
That's very helpful. Very helpful, Manuel.
Yeah. Okay.
Sure.
Yes.
I'll pick they're all very good questions. So I'll pick the second one on sustainability, because I do think that is the biggest challenge for all of us, really. Two parts to that, to the answer. One is, I think we really need to demonstrate that we can deliver what we're often doing in small scale at large scale, and that's easier said than done. I think we're all still very much working in small areas, small programs, but what if you really need to reach, somebody mentioned 250 million children affected by armed conflict? How to go about that? So I think the research agenda needs to shift from just demonstrating effectiveness of an approach to demonstrating that it works on scale. And what are the parameters to do that? How can we still deliver quality care? And you were alluding to that. Can facilitators of an intervention still deliver competent, have the competence to deliver good care when it's at scale? I think that's a very important part of it. The second part of going towards sustainability is how do you integrate, and it's an obvious one, but very difficult, I think. How do you integrate it within existing systems of care that are not reliant on us, at least us as an NGO? And maybe, I think there's two possibilities. One is how do you integrate it within community systems so that it's really community-driven? You were mentioning that. I was talking earlier about a community-driven, community-based child protection, and this is really working with local champions taking that approach of determining what child protection problems are and the answers forward. So that's embedding it within local structure. The other one is how do you embed it or integrate it within ministry systems? And again, maybe an example to make it simpler. I think there's a great push at the moment for example, the integration of mental health care into primary health services following WHO MHGAP program. And there's 193 countries have signed up to do that. I mean, that's a huge effort to make that happening. Or, for example, again, back to War Child, we have, and that's the last point, we have an education programs on tablets that works with serious gaming. We're doing that together with UNICEF in Jordan, but also in Lebanon and Sudan, and to provide education to children that don't go to school. And actually work with the local ministries of education to provide the curriculum of that country through those platforms. So I think these are ways of integrating it within existing systems.
Nicola.
Yeah, I just wanted to pick up on the question about social workers, and it's really picking up also on your question, Rachel, about how can we twin cash and care more effectively. We've just finished, led by Fiona Samuels here at ODI, assessment of the UNHCR and UNICEF cash transfer program in Jordan for Syrian refugees. And that was one of the things that came out very strongly from women and adolescents that we interviewed was how few had access to trained social workers. So the people who are doing the home visits are enumerators, are checking on household assets, but are not there neither in terms of their mandate nor their skill set to be dealing with the very intense, emotional and psychosocial vulnerabilities that people face. And so repeatedly we heard from the so there was a sample of 2,000 people surveyed and over 200 people involved in the qualitative work, that no one had been asking them about those aspects. But I think what's exciting is Maureen is saying that now there is a much stronger focus on replacing the enumerators with a social work function and a big emphasis on training social workers. But I think too often we rely on people to self-refer, to come forward, and there needs to be a much bigger push in these social protection initiatives, to reach out, because so many of the young people and the women that we talked to were effectively homebound. We had a focus group discussion which really stood out in my mind of a number of girls, I think it was about 50 during the day, who had not left the home in 5 to 6 months. They had not gone outside to put the garbage out. They had not been allowed to go to the market. They just literally had not left the house. And so how are we going to reach those people unless you have these sort of home visits by trained social workers? And so I would advocate that we really need to change what we think about as sort of a basic needs approach. So rather than just thinking about the material and the economic vulnerabilities, seeing particularly in conflict-affected contexts, the care and protection piece is absolutely critical. It's not an optional add-on. It needs to be seen as core. I don't know if you want to...
Yeah, I mean, I can add on that, and as part of ensuring sustainability of this work with building a team of social workers, we are embedding that within the government system, Ministry of Social Development, and the capacity building is actually linking with an academic institution in Jordan. So making sure that we are actually graduating social workers and then engaging them in case management work. So, and I think a critical work would be how we do the follow-up, as Nicola was saying, importance of following up on referrals and ensuring the effectiveness of these referrals, because you depend on case workers actually to do that, to do the case management for the children, to ensure the care and emotional well-being aspects are being addressed across in programming. Additional work on sustainability, just to mention, which Mark already talked about it, is the community system. For us, we are also working strongly with CBO, the local community-based organization. For example, now Makani has been running for 3 years. Many of the CBOs are able to run and deliver our components without UNICEF. We don't need to give them funding anymore. We have institutionalized our modules and our manuals with these CBOs, and now a lot of other NGOs who we don't even work with, national organizations, they ask access to our documents, so we involve them in our capacity building, and they run the programs on their own. So the whole program has already been embedded, and they're able to deliver these packages without us. On strengthening also the government role is how we have also expanded Makani by using Ministry of Social Development centers. Now we have about 20 centers that are run by Ministry of Social Development. And by doing that, we are making the ministry accountable to the issues of Syrians. We are making them accountable to ensure that even as a government, they also have a responsibility to provide services to refugees the same way they are providing to Jordanians. We are also working with Ministry of Youth, where they have 61 centers in Jordan that specifically targets the adolescents and youth. We are strengthening and building up their systems, understanding that these structures, if you invest on these structures as opposed to us renting through international organizations, which is what we were doing before. So now we have moved away from delivery through international NGOs by working through delivery through CBOs and government systems. And that means building capacities within there and institutionalizing those capacities where possible within the government as well as within the academic institutions. So we have actually launched a new, what we are calling a CBO capacity building initiative, where we are trying to build a cohort of CBOs that are working around issues of children to build an alliance and build their capacities as the CBOs, both governance capacity, administrative capacity, as well as programmatic capacity to be able to address issues of children in a holistic manner.
Would like to come in?
Sure.
Just a few minutes.
Yeah, sure. I'll be brief. I'll touch on the sustainability question. One of the things that's effective for us is actually ensuring that the program is replicated and led by young people. So the people running our program are actually in their 20s. and they're replicating the program for people in their teen years and also for adults. So because the demand is increasing for our program amongst parent networks now, also inside Syria too, by the way, word of mouth. That's really important. So allowing them and us being comfortable and trusting them as change makers to localize and entrepreneur their own versions of the program. I think that's really important, giving them that trust and that freedom. Ownership is key in terms of sustainability. The second thing is with local implementing partners that we work with, working with them on how they can integrate some of the concepts of our program into unrelated programs like sports programs or literacy programs. So actually working with them on that I think is really important. The third thing is we're building, because of a needs assessment from our community, we're seeing that in this work, there is touched on a lot of community-based things already on the panel. There is a huge need to decentralize tools for mental health and psychosocial support. The levels of stress and trauma are so high that whether you're 13 or 15 or 40 or 60, you need to have access or knowledge of how trauma and stress impact the brain, impact your body, and then some self-care mechanisms that you can employ, right? So if my sister is suffering through something, what can I do for next to them? So with UNHCR Innovation and Beyond Conflict, we're building a community-based mental health psychosocial support tool. And my colleague Mike, who's co-authoring it with me, he's calling it the Barefoot Guide for Psychologists. And we're going to be building this with our refugee youth communities, but we're combining a group of 20 to 30 contributors who are expert clinicians and psychologists and neuroscientists to co-build this together. And it's going to be a tool hand in hand, not just digital. The innovation isn't just technology and digital. It has to be relevant to the community. The last thing I'll say, a key thing for sustainability is burnout. I'm speaking from experience. I hit burnout earlier this year. A lot of my brothers and sisters in the field and my colleagues are suffering from burnout. Even the replicators in our program are suffering from burnout. It's important to, it's important to do the work, but we also have to sing to our own choir. We also have to sing to ourselves. Otherwise, we're going to be making bad decisions, and we won't be doing the job as well as we know we could. So tackling burnout in the field, in the work that we do, and really digging deep in terms of effective, tangible self-care mechanisms that we can do in the field and for ourselves is important. And I think we have to give it more investment and attention, and organizations should build a culture of self-care and well-being from the get-go, because otherwise we're hypocrites. If we're elevating others by diminishing ourselves, then we're hypocrites. We're not doing the thing that we're trying to teach these young kids to do. So I think tackling burnout for sustainability is something that we should really touch on, in the years moving forward if we want to continue this type of work as a movement altogether.
It's a very important point. Can we now have more questions from the floor? Thank you. Next,
Hello. Hi, my name is Julia. I'm representing Accenture here, also from consulting. Thank you for sharing your hearts with us and just your insights. Been really great. But I think a couple of words that have really stood out to me that you've spoken about a lot is this term ecosystem, community involving everyone, creating a safe space. So I guess it's a very simply phrased question, but how do you envision creating a space where we can actually invite all these different agents and partners to come together to kind of facilitate that organic communication? And what do you see your organization being the role in that, of creating that environment?
Thank you. Very important question.
Good afternoon. Thank you very much to the panel this morning, afternoon, and this session. I'm Anita Williams from War Child. And today's event is to commemorate Universal Children's Day. And I was really encouraged to hear about the very innovative approaches where you have supported young people to support other young people's voices to be heard. It's something that we want to get better at War Child. I wanted to ask, what were your takeaways? What were your lessons learned in supporting young people to support other young people, whether it's peer-to-peer reviews, peer-to-peer researchers, peer-to-peer support? Because obviously we have a responsibility to keep those young people safe in all aspects, and we have a responsibility not to increase harm, the risk of harm or injury to them. So it'd be really great to get some takeaways. Thank you.
Question over, yes, over there. So that's, so we've got one more here. That's four.
My name is Andrew Chi from Syria Relief. So my question was, a lot of the discussions that we've had today have been on kind of refugees and what's happening. Our organisation works inside Syria. So my question, I guess, is more, what can be done to really, some of the lessons that you've spoken about, what can be done to actually implement these things inside Syria? Because a lot of focus is on Jordan, Lebanon, Turkey. But again, we have an active conflict where the dynamics change and things are up and down. So I mean, those conditions that you speak of are not set inside Syria. So what can be done to address those issues?
And then just one more question here. Thank you.
Hi, Ilan Cernatura from London School of Hygiene and Tropical Medicine. My question is mostly for Dr. Jordans, but anyone else as well. But when I was hearing that your intervention structure is 9 different interventions together, it just kind of struck me for how difficult that is with treatment arms to evaluate a bundle of interventions together, and especially with scale-up cost and sustainability for 9 interventions. I mean, that's tremendous to actually try to prove what are the essential elements in that. So I was just wondering, in types of evaluations that any of you have used, of how to get at what are the most effective elements within a treatment bundle.
Thank you very much. So this will be the last round of answers. Try and keep the answers short, please. Sorry to say that to you, but we're running out of time. So who would like to go first?
I can go first.
Yes.
The question about safe spaces, that's exactly what Makani is all about. So we have built a network of 200 centers across the Governorate of Jordan. These are safe spaces providing comprehensive package of services delivered through local organization, CBOs, communities, as well as government institutions. And one of the component that I actually didn't bring it out very clearly, we have also specifically, while these centers serve specifically as platforms to support children in different programs that I talked about, which is education-related, child protection-related, as well as youth-related, we also specifically target communities and parents. We have structured sessions, community sessions for parents to do that. And Makani has actually been labeled, and it's a model that is being, to respond to the last person, it's a model that is being replicated across the region, Syria, Lebanon, all the countries that have Syrian crisis, also Turkey. So it's been seen as a regional model that is being taken to scale across all the countries in Middle East. The same platform we have through Makani. Another element is that we also link up with what we call referral platforms, particularly for youth. We have established networks for young people. So once they graduate from our youth programs, they're able to continue. So we have youth networks, which we call GIL 962. And these networks are online portal, as well as they also have civic engagement initiatives where young people who are graduates from Makani, they actually come together and do some civic engagement initiatives to contribute to their own communities, sort of like an opportunity to pilot some of the skills they have learned through our program. And these networks are running independently by, for, and with the youth. And we track them online because they also have created some of the innovative solutions you can imagine around adolescents and youth, which are programs that are designed by the youth. Some do not even need seed funding. Others are very innovative that sometimes we put seed funding to take it to scale. So that's what we have done. I think I'll leave it at that.
Thank you very much. One comment?
Yeah. I guess I'll touch on the space question, and then takeaways on peer-to-peer, and then inside Syria. Very important point. I'm glad you brought that up. For safe space, the way that we're building a safe space is to allow our Syrian replicators to define the space with the beneficiary. So they come up with specific guidelines to define the space before they do anything. It's one of the very first things they do. But how do you build a safe space? In my experience and with the experience of our replicators, it's communication. If young people, some of the people in the beginning of the program, they've been through so much that if you ask them a question, they freeze. They either freeze or they run out of the room. One, actually, that's an indication that there's some degree of comfort if they're crying in front of you, or if they choose to freeze and still stay in the room, that there's some degree of comfort that they want to take a step, but there's just something blocking them from doing it. Communication is the most important thing to creating a safe space, and letting them dictate like where that car is going to go. I think that's really important. And I can talk to you more about, there's a lot of methodologies I have that I can share with you if you, but for time, I don't want to take up too much time. Takeaways on peer-to-peer. There has to be an acceptance that it's going to be messy from us, and we have to give them the freedom and the space to make mistakes and to do things that we might not necessarily here in this room in London, in Blackfriars Road, might not necessarily see the point of or agree with. If we really talk about giving youth decision-making power beyond a superficial level, then that means we have to battle our own inhibitions and fears with that. And I've had to do that. It's been really uncomfortable for me. We have a lot of fidelity issues because some of our youth teams are replicating the program in Gaziantep differently than they are in Tripoli. That's okay. I've learned that's okay for me because they're defining what aspects of the program they need to focus on. The other side of it too is, we just have way more impact by trusting that group of 20 to 30-year-old like youth leaders to replicate it for teens. The part where it gets difficult is because the demand from parents is increasing, those replicators have been starting to replicate it for parents. And sometimes that goes really well, and sometimes that goes really bad. Because for those of us that know, culturally speaking, a group of mid-20-year-olds or 30-year-olds talking to parents or trying to get them to open up and communicate from an adult level, there's like there's a generation kind of bias thing going on there. So that's very difficult. But the impacts we're seeing on the teenage youth is incredible when they're leading it. But we have to, the issue I brought up about burnout, that's coming from them too. They're living on nothing. They themselves are going through trauma, and they're doing this hard work. They're doing the heart's work. This is the heart's work. When we talk about storytelling communications for community building, it's the heart's work. And you burn yourself out in doing that. So for them to build confidence to not make bad decisions, they are requesting these decentralized tools for mental health psychosocial support, not from a scientist and not in a scientific way, but something made and co-created with them that they're like, yes, that makes sense to me in this context. I can employ this with the kids that I work with. Not something coming from a university or somewhere, from a hospital somewhere, but actually building those tools with them. That will give them more confidence to go further, to go deeper. A lot of them are facing burnout, and as we know, burnout, as Justine Hardy, who's a psychologist, told me, is that every day you're feeling unqualified to do the work consistently, and that will burn you out. With our youth replicators, they feel confident to do the program, but they encounter these things from time to time, repeatedly, with their community, where they don't feel qualified to do the work, which is on us to then step in, and which is why I was in the Middle East 2 weeks ago, to provide working with a neuroscientist and giving that capacity building and mental health psychosocial support tools and neuroscience basics and things like that. So if we can feed them that and they're able to communicate their needs, then it can move in the right direction. But I will say going the peer-to-peer route is the best way to go, hands down. Even if it's scary and mistakes will be made, we're trying to innovate. If we want to break walls and not walk around them, let's not be afraid to make mistakes here and there. I don't think we should be so tight and frozen in that aspect of things.
Yes, thank you. It was just your point about how do we evaluate models to look at the question of bundling of different programs. So the GAGE program, the Gender and Adolescence Global Evidence Initiative, is partnering with the Makani Initiative starting from next year. And we will be embarking on a mixed methods longitudinal study. And the very nice thing about the design of the Makani Initiative is that people can sign up to different components of the package. So you can be part of psychosocial support or educational support. child protection or innovation. So because of the modular approach, then we're able to look at a range of different centres offering different bundles to then tease that out. And in the 3 different settings that Maureen talked about, in host communities, in camps, and also in the informal tented settlements. But one of the things, because it's obviously not a randomized approach to evaluation, then we will start with the baseline, not only looking at what the current situation is, but also with a reflection on how has the programming worked to date. So I think there's a real sense of having to look retrospectively as we start the baseline, but also using it as a way to move forward as the Makani Initiative starts its new 5-year program.
Sure, and maybe to add on, because nice question, by the way, thanks. Our approach is a bit different, and so in the sense that it's not meant to be one care system that all children get all the interventions for. It's really saying, look, this is a coherent set of interventions, and then within each different setting, based on the needs that community members have, that children have, you determine what elements of the care package you would be implemented. So it wouldn't be, and therefore also the evaluation isn't all 9 interventions together as a bundled package. Rather, we're saying each of them are individual interventions in their own right and go through rigorous evaluation. So basically, we are doing a randomized controlled trial on intervention A, B, and C separately. I think there is a lot of interest, and maybe that's our kind of the next stage, but we're entering that now, is to say, well, what if you add components together? So, for example, we are now looking at what if you add a stigma reduction component together with a tool that we developed to increase detection of cases. That speaks to your kind of the issue of relying too much on self-referral. So if we combine such components, can we then really demonstrate that we overcome barriers to care, for example? But initially, we will really go through evaluation of each of the components separately. Yeah.
Thank you very much. I'd like to thank everybody here today and those who've been online. It's really important that we continue this discussion. The event is being recorded and will be available on the ODI website. I think that's important in the coming days if you can tweet that out, put it out on other Facebook, other forms of social media, so we can keep the discussion going. Because this is not just about today and the deaf child, it's about every day. And for some children, and coming into adulthood, it's unrelenting. And I don't think any of us realise how terrible it is, because we go to it and we walk away from it. And to be living in that way, also to raise it hopefully in blogs in a few months' time, so it's not forgotten either. It's always good to look back on, and look forward to seeing you all again at some other time. Thank you to all the panellists as well, and to Emmanuel. You've been so great outside. Thank you very much.